Are you turning 65 and looking at these PPO plans, Medicare plans that don't have a premium and scratching your head and saying, well, what's the catch? Yeah, one of the things I always tell people is ask somebody who has a plan and has had to use it, especially for something serious, and ask them how they feel about it. Well, some people kind of roll their eyes and say, oh, I don't want to do that. Well, let me tell you what you're missing. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. All right, I've got a YouTube channel, and I've posted something about people who are looking at these plans, and is there something maybe that they don't know? And there's a lady, doesn't live in Georgia, and she offered a comment, and I'm going to read it to you. She offered a comment on one of my videos, and it says, I don't live in Georgia, but to me, the scariest thing about Advantage plans are the pre-authorization requirements and the frequency of denials of claims. In addition, there's other traps related to these issues. Some PPO plans even make claims about out-of-network providers that are not what they seem. My company has her employer plan has a PPO plan for retirees which states that cost sharing for out-of-network and in-network is the same, and out-of-network providers are never required to go through pre-authorization. Well, this sounds great, but just go to an out-of-network provider and then you'll find out exactly how it works. What they don't tell you in the marketing materials, but it's buried in the evidence of coverage document, which all carriers are required to produce and give to you, is that pre-authorization is still in place. And in-network providers are required to pre-authorize, go through the pre-authorization steps, and they do have to do the paperwork. But out-of-network providers, the patients themselves are responsible for filling out the paperwork for pre-authorization. Now, if that's something nobody's ever told you, then maybe you need to take a second look at that. Do you really want to tell your doc, well, gosh, I'm going to have to take a step back here, and I've got to fill out some paperwork for you before we can go forward? I mean, that's the dumbest thing in the world, but that, according to this lady, is the way it happens. And she closes by saying, in the end, the plan is in charge of your health care, not your doctor. That's very revealing. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.